In this video, we're going to talk about understanding neck pain, normal bony anatomy and function, and also ligaments and spinal instability. This is one part of a 7-part series. We encourage you to watch all of these to get the full idea and concepts so that you can be empowered with knowledge and make the best decisions possible to get to the root cause of your problem. Hi, I'm Dr. Todd Pickman from Gonstead Spine and Wellness. We're located here in Meridian, Idaho, and thank you for joining us on this 7-part series on understanding neck pain. First, we're going to talk about normal bony anatomy and function, and really this is part of ligaments and instability. That's the thing that I want to cover in this because a lot of people don't know about this when they're trying to explore and figure out why their neck is bothering them, why they have degeneration or arthritis or nerve issues, and it really comes back to one of the most important concepts to understand is the ligaments, the instability. Before we talk about that, we have to talk about the bony structure. So let's get into it. Typical versus atypical. What does that mean? That means there are 7 cervical vertebrae in the neck, 7 different bones. That's what essentially connects your head, your skull, to the rest of your body is your cervical spine. And it starts with C1, goes all the way down to C7. And there's what are called typical versus atypical vertebra. That describes the different shapes of the vertebra, characteristics of them, and that also dictates the function, and I'll tie that into where you see different types of problems most commonly and why. So this is a picture side view of the cervical spine. This is actually 6 of the 7 cervicals. It's missing the first cervical up here. So this is 2, 3, 4, 5, 6, 7, and that's actually T1 down there. So let's talk about the typical vertebra, the shape of them. This is a bird's eye view, and if you look at this, we see the body of the vertebra. That's this part over there where there's a disc in between those bodies, an intervertebral disc, which is a cartilaginous structure. It's a spacer. There's some shock absorption qualities to it, but really the true shock absorber of the spine is the cervical curve, not the disc. We'll get into that. So you have the body of the vertebra, and then you have these little arches back here, and then it goes to the spinous process. And the spinous process, that's what you can feel if you touch the back of your neck, the back of your spine. You can feel that bony prominence. That's the spinous process. In the mid part of the neck, you can't really feel it because they're buried pretty deep, but the lower part of the neck, especially if you bend your head down and you feel those prominent little spikes that poke out at the bottom, those are the spinous processes like you see on this lower picture right here. C3 through C6 really all look very similar shape. C7's technically a little bit different. I'll talk about that. Second type of vertebra we want to talk about, the most unique vertebra in the entire spine is C1. That's the atlas, and C1 is actually shaped like a ring, and C1 fits on top of C2, and C2 has a little post that sticks up called the odontoid process or the dens. C1 on C2 works in a way where it controls the majority of the rotation of your neck. So when you turn side to side with your head, it's primarily your atlas C1 rotating on C2. Because it has a different function of rotation, it's a different structural makeup. There's different ligaments up there. There's different types of injuries. There's different types of interventions. So that's C1 that actually fits on the top of this diagram here. It's missing in this diagram. That post that's sticking up is what C1 sits on. That post sticks right here, right behind the anterior arch of atlas, okay, the front part of atlas. And then axis, that's C2, bird's eye view, looks kind of funny and different. And you have this post right here. We're looking at a bird's eye view. We're looking at this part right here. And essentially atlas fits on top of there. This is also a very large spinous process. So this bump up here, if you feel like under the base of your skull, usually the first thing you'll feel when you trace down the base of your skull, that's C2 spinous process. Then the last one to talk about, that's also atypical, is C7. That has transitional features, meaning C7 is a very large spinous process. That is a transitional segment, meaning it is the one that starts to take on different characteristics, more like your mid-back or your thoracic spine. It's a larger spinous process, and the shape of these joints called the facet joints, which are those guiding joints in the back of the vertebra. So not the disc, but the facet joints behind the disc. They are actually flatter, more forward-facing like this, just like the thoracic spine. So that's going to play into some of, again, the different types of injuries injuries and mechanism of injury, different treatment methods that we're going to dive into. Okay, so this is a comparison side by side of like the 4th cervical and the 7th cervical, and you can see this long post back here. That's the spinous process, large spinous process. And then also these facet joints, those little kind of bluish opaque white features. It says superior articulating facet. That facet in the mid cervical spine at C4 is flatter, and then when you get down to C7, it's sitting on this type of orientation instead of flatter like so. That is the C7 right there. Now we're going to get into ligaments and instability. Now, this is a major thing to understand when you're trying to understand why you may have neck pain or what gets injured with certain types of traumas. The purpose of ligaments is that they connect bone to bone. Every single joint in the body has ligaments. So you have a bone, you have another bone, and in between them, you have ligaments connecting them. And the purpose of ligaments is to connect those bones together. It allows movement, but it also limits movement. So ligaments are check structures. They make sure that bones don't move excessively. And that's important in a lot of joints in our body, like in our shoulder, you have ligaments, in our knee. And if you didn't have ligaments and you didn't have those structures, things would just move way too much and they could be clunking around and they'd wear out prematurely and you could get injured and hurt very easily. But when it comes to the spine, it's even that much more important because the spine has a spinal cord, spinal nerve roots, and that is essentially the main neurological structure or the most important structure that connects the brain to the rest of the body is the spinal cord and the nerve roots. It passes through the spine. The spine is like armor that protects it. So there's all these ligaments that are very durable and tough when they're intact, and they serve a very important purpose. So we're going to talk about what they do and then also understand how to assess when they're not doing what they're supposed to be doing or when there's damage or injury to them. Right here we have a picture, side view of the neck, and you see all these structures are ligaments. There are approximately 10 ligaments between every 2 segments. There are deep ligaments. There are more superficial ligaments. This one back here, the ligamentum nuchae or the nuchal ligament, you can actually feel that. And sometimes if you go back and forth on the back of your neck deep and it feels very ropey, some people think those are muscles, but you're actually feeling the surface of that nuchal ligament. And there's even some cases where people say, oh, I bend my head side to side and I feel almost like a guitar string plucking over something. At times that could be the nuchal ligament pulling over those bones. More common when you don't have the proper forward bending cervical curve. That is something that we'll talk about is what is a normal curve? How does it get damaged? Well, in the case where someone has a whiplash type of injury, oftentimes you'll lose that cervical curve. It makes those spinous processes, those little bony prominences more prominent. They stick out more. And now that ligamentum nuchae pushes into it and it plucks across it like a guitar string, like I was saying. These limit movement. They protect the neural components like the spinal cord and the spinal nerve root. If you can see with my cursor here, the spinal cord fits right behind those vertebral body. There's a canal, there's a hole. If you look over on this one, you'll see there's a hole. If you look bird's eye view, there's a hole that goes down. That's where the spinal cord fits. And with injuries, like with a whiplash injury, that's what this is showing right here. You have a normal forward facing neutral. Then during the impact of whiplash, the head comes back. The back of the seat braces things in place. That's why it's so important to have a headrest, and the headrest actually supports your head because you want to prevent the head from coming back if you got rear-ended, hit from behind. But essentially, a whiplash injury is a hyperextension, hyperflexion type of trauma, and it can cause tearing of the ligaments behind the spine, in front of the spine. This is showing a very severe tear in these ligaments, the interspinous ligaments. Those are ligaments that are in between the spinous processes. Those are those bony prominences again, and there's a ligament in between them, and they prevent too much movement. When you bend the head forward, for example, if those ligaments are intact, they're preventing some excessive motion forward. There's ways of testing this, and part of it includes moving someone around and taking imaging in certain positions. Now, the disc is the most talked about ligament. The disc is a ligament. It fits in between the body of the vertebra, so it's over here between these bodies of the vertebra. The disc is a thing that you hear quite a bit about when someone has a spine injury. They say, oh, I have pain. And someone says, well, you might have a disc herniation, which is a type of outpouching or swelling of the disc, which can be problematic because if that disc bulges out, it can push into neural structures. It can push into the spinal cord or a spinal nerve root, which are the nerves that exit off of the spinal cord. Then they start to transverse throughout the body. They attach to what are called peripheral nerves, which are smaller nerves that segment off further and further. But the disc is the thing that's talked about quite a bit, and MRI imaging is the way to assess a disc primarily. We're going to talk about this in some of these other segments. The disc is an important ligament, but it's not the only important ligament, and a lot of these other ligaments are neglected. They're not looked at, they're not studied. Truly, when you want to understand what's going on with your spine, you have to find someone that understands how to diagnose spinal ligament injuries. That is something that we have taken quite seriously and we specialize in over at Gonstead Spine and Wellness, and we have some of the best technology in the entire state of Idaho as far as how to go through and assess and find these things. And they're often ignored structures, like I was saying. Next up, I want to show you a clip of a video that we made. This video was telling a story of a patient that we saw that was in a car crash, how we did the workup, the findings, and I think it's very relevant for what we're talking about here. So I'm going to play this. I'll stop it periodically to explain in a little more depth. Stress x-rays are obtained of the cervical spine. A stress x-ray is one that involves testing the limits of the patient's movement and then imaging the patient in that specific position. CM bends her head forward and backwards as far as she possibly can so that an image is captured testing the limits movement and then imaging the patient in that specific position. CM bends her head forward and backwards as far as she possibly can so that an image is captured in that end range. Right here, this is a flexion extension x-ray. This is just gold standard, has to be done if you have a cervical spine trauma. Now, the problem is when you get in a car accident, for example, and let's say you go to the emergency room, they typically don't take these x-rays. When you get in a car crash right away and you have muscle spasm and splinting and the neck hurts, that's your body's protective mechanism to try to hold things in place and protect. So it's hard to move. They might put a cervical collar on you at the scene of an accident. Okay, hopefully this doesn't happen to you, but if it does, you'll be better prepared to know what to expect. And then they're going to take you over to the hospital and they're going to take a look at the neck and they might do a static x-ray, static meaning not moving, just neutral position. And they're looking for any obvious fractures or dislocations where the joints or bones are moved excessively or there's a break. And then they might do a CT scan to see if there's any sort of break in the bone. But this is an important thing that should be done. If you're too rigid and guarded at the moment, you can't move because your muscles are so tight as a reaction to a trauma. This should be done a week or 2 weeks after that to then fully assess the extent of the damage by looking at the integrity of the ligaments. The ligaments, remember, connect bone to bone. They are there to allow movement but prevent excessive movement. So when you bend the head forward, the bones in the neck have a tendency to want to slide forward. The integrity of the ligaments prevents them from sliding forward. When you bend the head backwards, they have a tendency to want to slip and translate backwards. Again, the healthy ligament prevents that from happening. That's one thing that we're measuring on these x-rays down to the millimeter as far as how much those things are moving. That's called a translation. Another piece that we're looking at is also how much it's bending, which is called a rotation. How far each segment bends forward and backwards, each individual segment, not the entire neck, but each individual one, because if one is bending more than it should, that shows us also too that there's other ligament instability, ligament damage that's allowing that. I can't tell you how many patients we see that have had car accidents that have been to other doctors, been to the emergency room, physical therapy, chiropractors, neurosurgeons even, and they don't ever have any sort of flexion extension study obtained. That's a problem. This is the gold standard. This is actually in the American Medical Association Guide for Impairments, a textbook that is referenced all over the country, and it shows that if you are assessing someone's injury or damage to the neck, you need these stress x-rays, these flexion extension x-rays. Let's continue watching. This is the gold standard method established by the American Medical Association in order to screen for something called AOMSI, or alteration of motion segment integrity. This excessive motion could indicate that a serious ligament injury is present, and it's important for the clinician to identify so that the patient can receive the appropriate diagnosis and management for their condition. The purpose of ligaments is that they attach bone to bone. They hold things together. When the integrity of the ligaments are intact, bones are allowed to move within their normal healthy range. Now, from trauma, ligaments can be stretched and torn, thus failing to properly do their job, which is guiding a joint through a safe and healthy range of motion. In other words, spinal ligament injuries are some of the most underdiagnosed and missed findings after a patient is involved in a trauma, such as a car crash, slip and fall, or sports injury. Specific protocols have been established in order to measure the total movement. So this right here is actually a clip of how we digitize x-rays here in our clinic. We use some very sophisticated software. This is a special touch screen. We can blow up your x-ray. We mark points down to the fraction of a millimeter so we can assess motion and alignment. Very, very important. This is important to make an accurate diagnosis initially to figure out what sort of care needs to be rendered and what is appropriate, what's indicated, maybe contraindicated, maybe something you shouldn't do. Maybe we need to refer you out to another sort of specialist and escalate your care because we find something extreme. But then also this method of digitizing x-ray is also so we can measure where you're at compared to normal and then take someone through a corrective process of care. So let's say you've lost the curve of your neck, that nice healthy curve. Can take you through a corrective process, do things to restore the curve, restore proper movement, and then retest, re-x-ray at a later time. Usually that's done at least 3 months out. That's about how long it takes to justify making enough of an impact to then take a comparative x-ray and expect to see some measurable change on a patient's stress x-rays. And if the measurement falls within the normal range of motion, then the patient does not have a significant finding. If their measurement exceeds the accepted movement parameters, then there's a grading system as far as severity that is assigned to this particular injury. Okay, so this is getting really technical, but this is showing you that technically it's down to the fraction of the millimeter. 3.5 millimeters or more is considered a grade 3 spinal ligament injury, also called a sprain. A sprain means damage to a ligament. Sometimes we think a sprain is, oh, I just sprained my ankle, it's no big deal. Well, a sprain means that you've damaged a ligament, you've traumatized ligament, and depending on how high of a grade that sprain is dictates how severe that injury is, meaning how long it's going to take to heal. Will it be a permanent problem? Also, when you damage a ligament, when you deform a ligament, ligament will not necessarily rebound to be how it was prior to the injury, meaning it will never quite be normal. You've heard these stories, or maybe you've experienced this yourself. You injure your knee, you bend your knee excessively, you hurt it skiing, or you fall on ice or something, and then you say, I've always had a problem with that knee. Well, there's things you can do to compensate for that weak ligament, typically strengthening muscles, making sure you have good motor control, which is brain awareness and balance and coordination of muscle, good movement patterns, but the ligament is never going to be quite the same. So you can try to compensate with other things, other structures, so that you can live a normal functional life. There's more invasive methods to try to treat ligament. We talk about that later in this presentation, different regenerative methods. Ultimately, a ligament injury, unfortunately, those tissues will never be the same after they're injured, and the extent of the injury is important to figure out because, like, let's say in the case of a car crash, you're in a car crash, your symptoms go away after you treat, or your symptoms just go away after enough time and you think, oh, I'm fine. Well, if you had a spinal ligament injury and no one ever detected it or did the appropriate treatment, one is you're not actually healing properly, you just don't know it yet, and two is you have a lifelong injury that no one's ever documented, put on record. That's something that may entitle you some sort of compensation that you are rightfully entitled to so that you can be made whole or at least get treatment and care as much as possible to be as strong and functional as you were pre-accident status. Using some technical words, but those are some of the terms that are used when you look at the car accident industry. It's something we know quite a bit about. It is an industry. It's something to really understand that unfortunately the patient becomes seen as like a product to the sometimes doctor, the attorney, the insurance companies, and oftentimes they are just pushed through the system. It takes a special clinician to really put the care in place to properly identify the injury, document it properly to cover the patient's best interest, and then take them through a type of care that's going to help them heal and repair as best as possible. In the case of CM, some abnormal... This right here is actually a screenshot from the book, which is the guide for impairment ratings, very well referenced book, and it's showing this DRE category 4, a 25 to 28% whole person impairment rating when someone has at least a 3.5 millimeter translation slippage alignment measurement in a flexion extension cervical x-ray. What does that mean? Well, 28%, it's about 18% permanent impairment when you get your thumb cut off. These are all numbers that have been established by boards and groups. And again, this plays into the med legal thing. If you had your thumb cut off and it happened at work and they were responsible for going through the insurance and giving you some kind of payout to try to compensate you for this deformity, that would be called an 18% whole person impairment. That's worked into a factor to figure out how much compensation you get. Well, having just one level of the cervical spine that moves more than 3.5 millimeters, that's a 25 to 28% whole person impairment. So they acknowledge that this is such a significant finding and injury that it affects your health outcomes even more than cutting off your thumb. Some motion findings are discovered on her cervical spine stress x-rays. An additional specialized dynamic imaging study is performed next. This is called digital motion x-ray, or DMX, a very unique type of analysis that allows a patient to move through a full range of motion while obtaining 30 frames per second throughout the movement. This can expose crucial findings that are commonly missed on a static x-ray study. While undergoing the digital motion x-ray, another critical finding is identified in the upper cervical spine between the atlas and axis, or the first and second cervical vertebra. So real quick, digital motion x-ray, it's a very specialized type of imaging. We are actually the only clinic in the whole state of Idaho to have digital motion x-ray here in Meridian, Idaho. And we have patients that come from all over the state, even out of state, just to get this imaging done. They hear about it from maybe their attorney or their medical doctor or someone that knows about the importance of this sort of imaging to find and capture these findings that are oftentimes missed on other types of imaging. MRI looks at disc primarily. CT scan looks at different bony issues, fractures. X-ray has its purposes as far as alignment, fractures, dislocations. But the problem is with all those studies, they're static studies. They're not motion studies. This is truly a motion study. These types of injuries you catch when there's abnormal movement. So you need a motion study to assess this. This finding is the excessive side slipping of C1 on C2 when CM bends her head to the left. This indicates that there's excessive motion occurring between these two segments, which means that the ligaments that hold these bones together are compromised, further explaining her symptoms and also dialing in the exact areas of her body that have been injured as a result of her car crash trauma. We talked about a component in the upper cervical spine diagnosed by digital motion x-ray where the atlas, the first cervical, side slips. It moves excessively. There's different ligaments up there that get stretched and torn that allow that to happen. Very underdiagnosed problem. The mechanism of injury with that is typically, this is the classic one, your head is turned while you're sitting at a stoplight and someone hits you from behind and you get pushed forward while the head's rotated. That's not the only way this can happen, but that is one of the most classic mechanisms of injury. And then the head, which weighs 12 to 15 pounds, shears sideways, and then the atlas, that first cervical, side slips over C2, moves beyond its normal limits, and then the ligaments stretch and can even tear to an extent. And now you have headaches and dizziness and pain and brain fog and, maybe migraines, maybe even symptoms into the arms, muscle spasm. All kinds of symptoms can come from an upper cervical injury because it's the very top of the neck. It's where the brain stem exits the skull. So if you have some sort of irritation to those nerve structures, it can affect anything throughout the entire body. Some of the worst injuries that we see in the cervical spine is in the upper cervical spine. Remember, this is just part of a series. It's a 7-part series, so there's 6 other videos that you can watch on this. We invite you to watch them all. Please, if you found this helpful, share it with someone else. This information, we want to get out there into the community. So friends, family, coworkers, share this information. And if you are interested in getting an assessment to see what's going on with you, or even looking into what sort of treatment options you have, please feel free to give us a call. Our contact information will be on the page at Gonstead Spine and Wellness. When it comes to the health of you and your family, results matter most. Video presentation by Meridian Gonstead Spine and Wellness of Meridian, Idaho. Our practice is dedicated to people suffering from neck pain, low back pain, tension headaches, migraine headaches, herniated discs, and leg pain such as sciatic. We have treatment protocols for musculoskeletal aches and pains, joint pain and dysfunction, and whiplash injury. Gonstead Spine Wellness offers a distinctive chiropractic experience. It is the only office in Idaho with digital motion x-ray technology. And this advanced imaging tool, combined with the Gonstead spinal analysis and necessary radiographs, enables precise identification of spinal issues. We provide safe and effective Gonstead adjustments, corrective care through chiropractic biophysics to enhance and sustain proper posture, and a 12-week transformation program. This program includes access to a comprehensive video exercise library for ongoing home support, ensuring long-term health and wellness. Call us at 208-888-6077, where results matter most.